know you didn't hear me. I said painful sex. That is what happens when women come to our consulting room with this problem. They tend to beat around the bush, and then they will start whispering, painful sex. When I have sex with my husband, it's being I'm like, oh, relax, you can talk to me. Even when they come with their husbands, it's still the same. Because in this society, talking about sex is such a big deal that now if you have a problem with sex, if it's painful, you can't even talk to us about it. In this episode, we are going to talk about what painful sex is, what are the causes. There are so many different types of causes, what you can do to help yourself, home remedies and hospital remedies. If there are other causes, how we can help you, we medical doctors can help you. If you want to find out more, please continue watching this video. Don't forget to subscribe. This is Time with Dr. Adams.
Time with Dr. Adams.
Hi there, welcome to another episode of Time with Dr. Adams. If you're new to my channel, my name is Dr. Saki. You can call me Dr. Adams. If you're a returnee, thank you for supporting the dream so far. And today too, you're welcome to my channel. Today we are talking about a serious problem. Yes. I've had a couple of men complain to me that their wives literally weep when they have sex. It is that bad. I mean, there are levels, but some are really that bad. They feel like knives in their vagina anytime they have sexual intercourse with their partners. So that is why we are doing this video. Painful sex, in medical terms, we call it dyspareunia. It is persistent, painful intercourse. It can be before, during, or even after the sexual intercourse. It can happen to both men and women, but it's mostly with the women. Research has shown that when you take every 4 women, 3 of them are having dyspareunia. That's a painful sexual intercourse or painful sex. That is equal to or approximately 75% of sexually active women going through or having this problem. So you see how big it is. However, we live in a society where we hardly talk about sex. So if a woman is having this issue, and mind you, this issue can be this tiny or it can be very big, depending on the causes. This society, we've made sex such a big deal that women find it difficult to even come to the hospital and complain about this. And sometimes they can come to the hospital, but you see that they continue to beat about the bush. Painful sexual intercourse can be divided into primary and secondary. Primary is when a woman has had painful sexual intercourse throughout her life. From the first time she had sex till forever, she's always had a painful sexual intercourse. And with the secondary, initially there was no pain, but later on she might have developed any form of a medical condition which brought about a pain. We can also classify it into superficial pain and deep pain. Superficial pain is localized just around the vulva and the entrance of the vagina. When it's around the vulva, it's termed as vulvodynia. And when it's deep rooted, it can be around the pelvic floor, or the woman feels it just inside, especially during penetration. All these have causes. So let's take some of the causes. 1, it can be emotional or psychologically linked. If you are having a quarrel or you fought with your partner before you had sex and emotionally you are not on the same plate, you might have some form of discomfort or pain during sex. General conditions like depression. If a woman is going through a process, a difficult time in her life, she might have some form of pain during sex. Breastfeeding. I have a video on how to increase the libido of a woman after she's given birth or whilst breastfeeding. You can watch it and see what I said, but generally a woman who is breastfeeding might have issues with sex. Her libido might be low because of the hormones. The prolactin is high. That's the hormone that's responsible for production of milk. So generally she might have some form of discomfort. And a woman who just had a baby, I spoke about this in that video as well, probably she had a vaginal tear and it was sutured. There might be pain around that side. So having sex will or might be painful. We also have pain during penetration, which we call entry pain. Usually, this entry pain is as a result of dryness. I'm sure you have someone or you've heard of a woman complaining of vaginal dryness. So let's talk about the causes of vaginal dryness. Generally, there are some women with this issue that comes naturally because some forms of their hormones are low. And there are some women who bring about these vaginal issues to themselves. Sometimes you're taking some form of antibiotics or even going through chemotherapy, you might have vaginal dryness. Women who are premenopausal or are going through menopause have serious form of vaginal dryness. Women who do what we call douching have serious forms of vaginal dryness. Women who are found of putting things in their vaginas. We keep saying this, some of us women, we keep saying this. Stop inserting things into your vagina because some of these things, some of these spices they insert there, they irritate the mucosal membrane of the vagina, which will in turn cause some scars or eventually will cause some form of dryness, and then you'll be running helter-skelter seeking for solution for this problem that you brought onto yourselves. There are some scented soaps that will cause irritation to the mucosal membrane. When I say mucosal membrane, that's the surface lining of the vagina. Some forms of soap will cause that. We have a lot of vaginal cleansing, whatever gels on the market. Some of these also can cause irritation to the lining of the vagina. And at the end of the day, it would definitely bring vaginal dryness. A woman who's had trauma, accident, or has had surgery around the pelvic floor or connected to her pelvis might have pain during sex. Imagine you had an accident just around that side. I've seen someone who sat in a pragya, came with a cut just very close to her vulva. Definitely this woman for months to come or years to come might have pain when she has sex. If you had surgery, maybe you had fibroids and it was removed, or any other surgery that is around your pelvic area, it might affect you when you are having sex. There might be any form of pain. Then we come to infections. Let's start from urinary tract infections. Remember the video I made on the anatomy of the female. If you haven't watched it, please go look for it. It's under the women's health when you go to my playlist. I told you people that, and every woman knows where her clitoris is. So for instance, if that's your clitoris, just below your clitoris, you see an opening. That's where you will be from. That's what we call your urethra. Then you have your vaginal opening. Yes. So after the vaginal opening, you come a bit down. That's where your anus is. Your anal region, your vagina, you can have microbes migrating from this into your urethra, which can cause a urinary tract infection. A urinary tract infection can come with burning sensation when you urinate. Usually people do not know where the pain is coming from, so they will say, I have pain in my vagina when I urinate. But you don't urinate from your vagina, you urinate from your urethra, which is just below your clitoris. So when that place is infected, of course that little entrance is inflamed and it's a bit swollen. You might not be able to see with your eyes. However, if you have this UTI, definitely when you have sex, you might have some form of pain or discomfort. That is why we usually advise our women that after sex, if you can, just pee. Because sexual intercourse comes with a lot of movement, and maybe microbes might move from your anal region or your vagina to that side. So definitely after sex, if you can shower, good. If you can urinate, that is also good. Women who have pelvic inflammatory disease, which usually can be as a result of sexually transmitted infection. We cannot overemphasize this, that anytime you are having vaginal discharge and you are not sure what it is, even if you are sure what it is, please go to your health service provider to treat you appropriately. Because sometimes you might buy an over-the-counter medication, you might think you are fine in the interim, but inside there is something happening. And PID, which we call pelvic inflammatory disease, can give you a whole lot of problem. It can even cause ectopic pregnancy. So definitely, if you're having a discharge, if you're someone who's had multiple sex partners, or you are not fond of using protection, any form of protection minus condoms will not protect you against STIs. If you want to protect against pregnancy, that is fine. But when it comes to STIs, either you are abstaining from sex or you are using a barrier method, which is the condom. Other forms of infections might be vaginitis, simple inflammation of the vaginal lining, even having simple thrush or what we call vaginal candidiasis can make sex very uncomfortable. The underlying statement I'm saying is, go to your doctor if you think you have a vaginal infection to be treated appropriately so that it does not go on to have a problem to affect you when you are having sex. A woman who also has ulcers around her vagina can also cause that. You know, sometimes you have constipation, you go and poo-poo and you push so much that you might have some cracks around that side, or even you feel a bit of itching there. You have a thrush infection or yeast infection and you scratch that place so much that you are bruised. Definitely when you're going to have sex, you might feel some kind of pain. There are women with other medical conditions like fibroids. Fibroids are non-cancerous growths that form in the uterus. It can be outside the muzzle of the uterus or inside the muzzle of the uterus or in the inner lining as well. And definitely if this fibroid is big and you are having sex, it might move. Some women even bleed after sex. If you are having painful sex and you are bleeding, please, 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 go and see your doctor to be helped. There is another condition we call endometriosis. Women with endometriosis feel pain, severe pain. Now, I've listened to some women who have this condition and they describe the pain as very sharp, like pins during sexual intercourse. Anytime the penis enters their vagina, they feel like something cutting them, that much pain. And men who complain about their wives who cry throughout sex should take them to the hospital to be investigated, because diagnosing endometriosis is not easy. Endometriosis is when the lining of the uterus, the tissues that is supposed to be found in the womb, is found outside the womb. It can be found on the fallopian tubes, it can be found on the ovaries, it can even migrate all the way to your lungs, and their symptoms are not specific. So diagnosing it is very difficult. So if you have a wife, you have a partner who has severe pain, cries terribly during sex, please investigate further. There might be something more. Other conditions can be ovarian cysts. Ovarian cysts is just, imagine a small balloon on your ovaries, which might cause pain, because you know during thrusting, when you are having sex and you are thrusting, there might be a movement, a bit of movement there. It can cause pain. Vaginismus, that is involuntary spasm of the pelvic floor. This usually can be helped with exercising and just relaxation. The pelvic floor, that is, imagine from your vulva all the way to where your anus is, that's the pelvic floor in there. It has become so rigid that during sex it is so painful. Now, how do we diagnose that a woman has dyspareunia? Number one, go to the hospital. I keep saying this, our bodies are different. The fact that your neighbor is also complaining about pain during sex doesn't mean your causes are the same. I made a video that my first sexual intercourse was painful, but after several sexual intercourse, I realized that when I get wet enough or there's enough lubrication, there is no pain. But my neighbor's own might not be due to lubrication. So for diagnosis, please go to the hospital. I know it is a very delicate topic for you to talk about and you might feel shy. I'm talking to the women. Even if you are going with your husband, I know there's a bit of stigma around it. But believe you me, We are trained for this. Come tell us your problem. Don't feel shy. When you come, we are going to ask more details. When did this start? How often do you feel it? Is it every time you have sex? Is it when you don't have enough lubrication or there's less foreplay? Is it after you delivered? Is it after you've had pelvic surgery? And we will ask you to define or describe the pain. Some people's pain is during penetration. That's what we call the entry pain. And others is when the man has already penetrated deep inside. That's the deep, painful sex. Do not feel shy when you are we are asking you all these questions, because we just want to help you. Then we can go a step further by having a pelvic examination. You just lie down for the doctor to see your vulva. Sometimes just simple physical examination can bring out the problem. We might see something that you thought was normal. For example, I've seen someone with genital warts and she thought it was normal, but it was growing. She thought it was just a growth and she was applying these herbal medications, so she thought it would go away. But genital warts can also give you pain during sex. After the physical examination, we'll also do pelvic examination. There are some people with big fibroids that when you examine the abdomen, you just feel that there is a mass there. Now that gives us a clue. So we will then ask you to take an ultrasound to confirm what we initially thought it was. Please, 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 please do not sit at home. There's a proverb in Tree that says, meaning if you tell someone your issue, you might find the solution to that problem. So come, we are here for you. So what are the possible treatment or management of painful sexual intercourse? Number one is to identify your problem, and that is when you come to the hospital. If your problem is emotional or psychological issues, sit down with your partner, sort out whatever issues you are having with each other, so that you are on the same plate when you are having sex, for the sex to be enjoyable and with less pain. And then we come to next, enough lubrication. I already made a video on this about lubrication. A woman sent me a message on Facebook telling me about how dry her husband complains she is, and she thought she might react to the lubricants around. I told her the best choice of lubricant is a water-based lubricant. When you go to the pharmacy, do not be shy. Go and tell them you are looking for excess lubricant, but you want water-based. Water-based is just like water you are pouring inside your vagina. If you don't react to water, then you definitely will not react to such lubricants. Lubrication is very important for women who have dryness, especially premenopausal women and women going through menopause, and for women who are not sexually experienced that much. Either your husband should invest, or both of you should invest more in foreplay, or you help each other with the usage of these lubricants. However, there are some women who might not just need the simple lubricants, but will go a step further and give them estrogen lubricants. They are estrogen creams. These have hormones in them, which will also help them. Other management, if you are having a UTI, when you go to the hospital and it's checked, you'll be treated with an antibiotic. If it is an STI, you will definitely be treated, and most importantly, you do not treat one partner, you have to treat the other sexual partner, because if you treat just one, there will definitely be reinfection. So whatever type of infection you have, so far as the doctor picks it up through the physical examination and through the other diagnostic methods, they will give you treatment for it appropriately. However, if it is fibroids, you have to talk to your OB/GYN to find out which modes. Some types of fibroids are left alone, especially if they are asymptomatic. If there's just a little bit pain, we give a pain relief. But some fibroids, you might need hormonal therapy or even surgery. That is when you need to talk to your gynecologist. If it is endometriosis, definitely as well, you also need to talk to your gynecologist. With all this, make sure that through your management and through your treatment, you have had a discussion with your partner, because I always say that sex is two ways. You cannot be having pain and be sitting down and thinking that it is normal, it will go away if I do this. Have a talk with your partner. Then you go to the hospital together to find out the real cause, and you move towards the direction your doctor tells you. Tell me in the comment section below if I left anything out, or there was you've gone through that process and something helped you. I want to know in the comment section below. But I just want you to know that painful sexual intercourse is not normal. You can't be helped, but all you need to do is to go to your nearest hospital to talk to a doctor. This was Time with Dr. Adams. If there are any topics you want me to cover, please let me know in the comment section below. And please like, share, comment, and don't forget to subscribe. And remember, still, yes, more.
Time with Dr.